Hello again. Welcome to the Ask Dr. Pane segment, where we take your questions and provide the answers the best we can. Today's question concerns labiaplasty. A young woman has redundant tissue of the labia minora and is curious as to what type of surgical technique is appropriate for her. And in the images, there is a moderate amount of redundant tissue that I was describing. And she's concerned whether or not the longitudinal excision or the V wedge technique is best for her. Well, that's a great question. And the answer is, like a lot of things in plastic surgery, is not an exact right answer for all patients. Now, you have to keep in mind those are the two major techniques of doing labiaplasty. Not all surgeons do both techniques. And you have to be a little careful that when you're in a consultation, if you are suspicious that maybe you need one technique and you get the sense that somebody's trying to put you into a different technique, you might want to ask a little bit about that. You have to be careful. Like I said, here in Florida, you have to watch it, what these recommendations are. This is a little different than other areas of the country. Now, there's no exact correct answer. If people have a lot of redundant tissue centrally and it's protruding out and they want the minimal type of scarring that is possible, then in those cases, I like the wedge technique. And I do the wedge technique in a way that has a minimal chance of it having a problem. Sometimes the wedge techniques can have healing issues that you don't see as much with the other type of procedure. So in that case, patients in my hands, I will use that V technique on them when that's what they're looking for. But many people have redundant tissue going the whole length of the way down and they want it trimmed back to the level of the labia majora. And in those cases, they are going to be better off with the longitudinal technique. Now, in either technique, in my hands at least, we can also incorporate the upper clitoral hood tissue as needed. So you don't have to worry, at least in my practice, that we're trying to put you into one technique or the other because we don't do it. We do all of it. What we do is we try to match the technique that you're looking for that's going to give you the result that you're going to be happy with. And for that reason, we don't have an exact right or wrong answer. More people, when we hear this out, tend to have me do the longitudinal technique because that's what more people are looking for, but not all. And some people say, well, the longitudinal technique leaves more scarring and that can be a problem. I have not found it to be a problem. I close these incisions as precisely as I would close somebody's eyelid, face, or anything else. And I have yet to have a problem with a longitudinal excision closure technique. Even with the V technique, essentially no real issues with that as well because of the way I tend to preserve the tissue. There are a few well-known famous surgeons on the west coast of the United States, and what I tell people is I do both of their techniques. So there's not a problem in terms of me doing one or the other or anything like that. And I think that is the mentality you want to carry with you when you go into a consultation. Because again, there's no exact right answer. You want to make sure that what you're going to have done is going to meet the goals that you're looking for. So hopefully that will cover it well. It's a great topic, and if you have any more questions, feel free to send us a message. We'll do the best we can to answer it. So we'll see you next time.